What they're noticing is weight changes, difficulties with sleep, or brain fog. They notice that their blood pressure is coming up. They notice that they're a little bit more sensitive to foods than they would have normally been.
I need to actually know my patient. I need to understand my patient. I need a time to be able to make clinical decisions.
And if you think about, you have a menstrual cycle typically every month. If you're slightly estrogen dominant, you might have more cycles and heavier, longer cycles per month. So that's a significant portion of your life that you're spending suffering, which is heartbreaking.
Hi, I'm Dr. Michelle Leary. I'm host of the new Vida Vitality podcast. We're so excited to bring this to you. It's been in the works for multiple years. This is a way for our doctors, guests, people who are experts in their field to then bring real-time information on what they're reading, what they're talking to their patients about, what they're passionate about, and translate that information directly to you. Hello and welcome to Vida Vitality Podcast. I'm your host, Dr. Michelle Leary. Today we have a very special episode for you. We're going to be talking to Dr. Alexis Gonzalez about all things functional medicine, women's health, hormones. We have a very exciting episode in store for you. She has her undergraduate degree from St. Mary's College in biochemistry. She then went on to get her master's in biotechnology from Johns Hopkins University after working in a lab for a year to get her doctorate from Bastyr University in Naturopathic Medicine, in which she completed in 2020, the height of COVID. She then decided to do a dual residency with Vida Integrated Health and the Institute for Functional Medicine, a prestigious medical education organization. She then went into private practice after 2 years finishing her residency, and she decided to specialize in women's health. She is also a senior implementation specialist currently at Ovation Lab, and she returned to Vida this past spring as a women's health specialist. We're very excited to welcome Dr. Alexis Gonzalez. Thank you so much for being here.
Thank you for having me, and thank you for that intro.
Yes. Oh, it's so exciting to have you and very special just for us to do this together. We've known each other for 5 years now, and it's been a long time coming. I want to just start with just talk to us about your personal journey and how you got dialed into naturopathic medicine, functional medicine. Take us back to the maybe pre-Bastyr and what went into that decision.
Yeah, I was raised in a family of primarily like females in healthcare. So my grandmother was actually a pathologist and an autopsy doctor, so spent a lot of time in the county hospital waiting for her to do any type of procedures or do her reports. And then my mom started as an ER telemetry tech and then is now vice president of the same hospital she's been working at for the past 30 years. So these really long-standing careers within the hospital system, primarily amongst the women in my family who have devoted their lives to service, both for their families and then for their communities at large. So I would like to say that it's like inherently in my DNA to be in this position in just my own particular way. So when I started at St. Mary's, I definitely knew that I wanted to do any type of science. I think that's initially what kind of attracted each other to, or you and I to one another, is that we would just nerd out on a lot of mechanisms in biochemistry and physio together. And once I left college, there became the opportunity to either go into the lab scene or go into the medicine scene. And I decided to explore biotechnology because I thought that would be a really good play into some of my strengths. So I had seen the same 4 people every day. There were no windows in the lab. You're doing the same process over and over again, which has a lot of value, obviously, to medicine at large, but really was missing that more human interaction and I think just more of that human touch. And so actually applied to medical school, was in the middle of interviews and found out about Bastyr just by happenstance from a colleague. Started learning more about naturopathic medicine and actually withdrew all of my interviews and applied to Bastyr. And then that was the beginning of my naturopathic medical career. And Halfway through my career at Bastyr, there also came another opportunity to transfer up to Washington because I was at the San Diego campus.
Bastyr, San Diego.
Correct.
Okay.
So halfway through medical school, a bunch of my friends and I decided to move up to Washington and finish out the last 2 years here in Washington, primarily because the scope of practice here is so much wider. And that decision has actually completely changed my life because during those last 2 years, I met Dr. Kate Bresnay, who ended up telling me about this residency at Vida. She basically recommended that I apply and thought that it would be a really good fit. Interviewed and fell in love with Vida, and it was literally a life-changing decision to not only come up here, but meet you and be a part of the Vida family, be a part of the Institute for Functional Medicine. And then during my time here at Vida, was working closely with Dr. Clea Waddles, who was transitioning away from her fertility practice at Vida. And again, came this opportunity to then be exposed to women's health and fertility and focus the primary care practice that we were building during the residency, primarily on women's health. And so that's what started this whole journey on women's health. And then during that time was also diagnosed, which you were the one that actually diagnosed me with endometriosis back in 2020. And so that's what's inspired this whole pursuit and passion of really helping others with endometriosis, because you're one doctor. And I just suddenly realized that there's very few, if any, doctors that are at the level of expertise and support that you were able to offer me. And so among many other things that you've inspired me to do, that was really what set me on this journey to pursue endometriosis.
I'm wondering if you could then talk about why you pursued functional medicine as opposed to, there are dozens of naturopathic medical residencies out there. So why functional medicine? What attracted you to that kind of division?
I'm very type A. So there's a part of my just inherent being that loves a framework and a system. And what naturopathic medicine and naturopathic medical school does an amazing job is it gives you a bunch of tools, resources, really builds a robust toolbox for you to use a bunch of different modalities to support your patients. How to actually do that in the setting of an insurance model for primary care in the context of a visit that's anywhere from 15 to even 60 minutes long, that's a different challenge that I don't think you really get as much support with, because it really just comes from doing it over and over again and refining those skills. And what functional medicine does is several things. It allows you to actually systematically apply all of those tools in a way that's still efficient without burning you out. But what I really loved about functional medicine is it created this common language between integrative medicine and more conventional medicine, where we aligned on terms that we were using to describe approaches to health, how to describe body systems, how we were actually making systemic connections between symptoms and diseases and patient values and beliefs that I think would have been harder to explain, or at least get the whole conventional medical system on board if we didn't already have that buy-in just on
common language.
Exactly. On how we're approaching and calling certain diseases and approaching certain care plans, for example.
Yeah, I agree. I also think that there is a systems approach to functional medicine that certainly has its roots. I think we would both agree in naturopathic medicine.
Oh, yeah.
But perhaps the structure or organization or way of learning and understanding how to apply those, I would say, those historic systems to modern medicine is really where functional medicine has shined.
Totally.
And I think you have done a great job of explaining why. So
I think you've built the perfect residency program where you get to practice both fairly equally and synergistically in a way that you can still offer insurance-based care to patients and still offer them primary care and still be able to see a lot of patients and still offer that level of medicine.
What you just touched on, the importance of primary care as the foundation of learning. Talk to me about just your experience, your perspective. You've worked with a lot of colleagues who have chosen to specialize right away and not taking anything away from those individuals who certainly have a ton of value to offer their patients. But from your perspective, why is the foundation of primary care, and why is a functional medicine provider who can offer both, and or perhaps they at least know the framework of the primary care generalist? How do I manage basic things from a cold to elevated liver enzymes to high cholesterol to hormones? Why is that important?
I think it's several things. One of them is it's really hard to practice whole person care, which is a principle of functional medicine and naturopathic medicine, without being there for all of the acute stuff and the in-between stuff that isn't primarily focused on hormones. And you have to accept that part of specializing because you know that those other mechanisms are either a result of some hormonal imbalances or they can be drivers for hormonal imbalances. So to treat the endocrine system in a silo isn't necessarily the approach of a lot of people who specialize in this medicine, but it's a lot of what we call punting, right? Of where you need to go back to your primary care provider to go do this, X, Y, and Z, and then you can come back to me. So outside of not being able to truly offer a whole person care approach, it's also isolating yourself from this whole multidisciplinary care system or care team that you try to put together for your patient. And part of the difficulty that I find with that of being a solo practitioner and being back in this group practice is it makes it really annoying and hard for the patient to have to manage multiple care plans, to have to communicate things from me back to their primary care provider and back to me. So you try to work around that, right, by doing care coordination letters, contacting other providers. That's still time on your schedule, and it's still time outside of the visit. So the other piece to that is by offering everything in one visit, you actually can offer an enhanced level of care because you're getting to know the patient on a much deeper level. And it is part of addressing women's health. I want to know how often you're getting sick. I want to know when you get those gastrointestinal infections. I want to know when there's more stressful periods in your life where you might need an antidepressant, where you might feel like that's a little bit of a scope creep if you are primarily focused on women's health. Whereas if you're the primary care provider, you're so attuned to those very more subtle shifts in their health.
Mm-hmm. So just to put you on a spot, I'm wondering if you could share just an example or two that you might have and how you apply this on a regular basis.
Yeah, I would say one of the most common examples I'm seeing more recently is just this perimenopausal period. Where patients are rarely scheduling for a perimenopausal appointment. Oftentimes it's for some type of symptom or shift that they are just cannot attach to any particular lifestyle change, and things have remained the same for them, but their body is changing, which they're not necessarily attaching to hormones, nor are they seeing a lot of hormonal associated shifts that you would typically think of, like changes in their period, for example. So what they're noticing is weight changes, difficulties with sleep, more brain fog. They notice that their blood pressure is coming up. They notice that they're a little bit more sensitive to foods than they would have normally been. And having all of those symptoms taken in, you could easily say, I'm not really managing your lipids or your cardiovascular health. You need to go do that at your annual exam. But we know that during the perimenopausal shift, you can see increases in LDL cholesterol. So to ignore that as part of your woman's health evaluation and management plan feels like a misstep, honestly. And it feels like you miss those very early signals for these hormonal shifts that you may not even catch if you didn't even think to look, because you think that's primarily in the bucket for primary care providers.
Yeah, couldn't agree with you more. Yeah, you and I are definitely aligned on that. What do you feel distinguishes functional medicine from conventional primary care? How is functional medicine primary care different than conventional?
Really, to me, the biggest difference is just taking the time. Like, I think we see this shift with a lot of conventional medicine providers actually leaving their insurance models to just have more time to spend with the patient, because it's impossible in 20 minutes to review labs, check in with the patient, or less, take vitals, take in any new chief complaints that's outside of the labs, or to even go over a 5-page lab report in depth. So you're really just triaging the most important things for the 20-minute visit, which we know from functional medicine, there's so many things that come up at follow-up visits. Yes. And there's so many things that come up from just asking about certain shifts that are associated with these lab changes that we're seeing, that only come from having the time and space to have that conversation and that discussion. So I would say that to me is probably the biggest difference. And what I'm excited about is that there's this recognition of how impactful that is to spend more time with your patients, and how people are really shifting their practice models. And there's actually more demand from patients to say, hey, I need more time with you to actually talk this out because I don't understand what's going on.
Yeah, there's a book that came out, at least 10 years ago now. I want to say 2012. It was a book titled, it could have been maybe 2014, The Patient Will See You Now by Eric Topol. And it really had examined this patriarchal medical system and how it's like you come in, The doctor dictates what we're going to talk about predominantly, how much time you're going to have allotted, and kicks you out the door in a lot of ways. And patients have changed the way that they are asking for their healthcare to be delivered.
100%.
It's a consumer-driven market in some ways. Unfortunately, not in all systems. There are certainly many systems from a cost perspective that are still very much in that patriarchal system. But for functional medicine providers or even other conventionally trained providers that may be just needing more time, they're saying, hey, I need to actually know my patient. I need to understand my patient. I need a time to be able to make clinical decisions that are not just about acute care management.
Right.
Because predominantly over 85% of primary care visits are about chronic conditions.
If you think about if you go to the emergency room, if you go to a specialist, if nothing really comes from that visit, meaning that there's not a frank diagnosis and a treatment plan, majority of the time you're getting sent back to your primary care provider. And it's not typically your functional medicine provider. It's usually your primary care provider. Yeah. And something else that I think is also really important is this transition from just healthcare to more hospitality, yes, where it's not just the demand for more time, but this expectation that there's this level of customer service from your provider, which I think is very different than how medical care has ever been delivered before, and how that contributes to the value that patients are really tagging on to how much they think is worth them paying on a monthly basis.
In a concierge model.
Exactly.
Yeah.
And we have beginning trainings of that in naturopathic medicine in regards to the therapeutic alliance and how you listen and be present and retell the patient's story to make sure that you're of equal understanding of what's going on. But now there's this next element of, no, I need you to reach out to me when I have my follow-up, or I need you to help me schedule all of these specialist appointments, or just the stress of seeing you is actually causing me a lot of stress and causing my blood pressure to be elevated. Yeah. So how can you then mitigate that and create an also therapeutic environment in your clinic? So it's a really interesting time also for functional medicine right now in regards to expectations that are beyond just an elite level of healthcare.
Yeah. So being an excellent doctor, but also creating this level of service, of kind of a customer first presentation, is really where the evolution of medicine is going, right, at least in areas that are choosing to pay for their healthcare services beyond what insurance typically offers.
Right.
At least right now. And that's evolving. I want to ask you about some of the criticisms that have historically and currently come up around naturopathic medicine, integrative medicine, functional medicine, and how you as a provider handle those criticisms. And maybe if you could just speak to what you think about where those come from, and are they valid? Are they not valid?
Yeah. In my earlier years, I think when starting in school, I was a lot more fiery and ready to fight the good fight in a more like verbal and angry way. I think because you invest so much time and effort and energy that it hurts, right? To be criticized for something that you're devoting your life to. And as you mature in this medicine and you actually start to practice and help patients, there's an element of humility that you just learn to incorporate in how you practice medicine, because we know day in and day out the people that we help, and we see the lives changed, and we see the desperation that people come to us with. And so another way that I like to essentially address that in a more direct way is to be a really great doctor, because there's really no way around you just practicing really good medicine and having people see results. And no one can really argue or push back on that, especially knowing that we're practicing really safe medicine that is still within our scope. So I think where that typically comes from is when there are providers that are practicing outside their scope, or they're not fully educated on how to practice both conventional and functional medicine. So there's a little bit of a gray area where they're not fully educated on how to do things appropriately. And then not being open-minded. I feel like that has been one of the biggest things that I've learned being a part of IFM for so long and being a part of this community is, at the heart of it, we all really want our patients to just get better. And we also don't want to be burned out in the process of doing so. And so when you approach these conversations with more of an open mind, humility, and really an empathetic approach that you and I are both doing the same thing. We're trying to help the same people. We're trying to help make the same impact in healthcare. Then that just leads to a more open conversation and less of this adversarial energy.
I agree with so much of what you just said. I would add that I think just human nature, if we look at beyond just medicine, is humans fear what they don't know. And if somebody devotes their life to the conventional study of medicine, they have no exposure or knowledge of some of the approaches that you and I regularly employ, it may immediately, the knee-jerk reaction may be, it's not evidence-based, or this is unsafe, or this is something that is snake oil, or whatever it is. And most of the time, that's just not true.
Right.
Of course, there are situations where there are providers out there that may be doing things, and this goes for both conventional and integrative practitioners, that are really harmful. It really should be, there's a word of caution there. It's not that there is absolutely no room for people to be out of line. But I think what you were saying in terms of the open-minded piece is a lot of people fear what they don't know.
Right.
And if we can continue to have just conversations and communication, and most importantly, practice evidence-based medicine that is not just these large scale RCT, double-blind, placebo-controlled, which I think you and I would both agree are incredibly important and valuable, and there's so much importance that we would put on those. But there's not funding necessarily for every single intervention to go through that level of rigor.
Nor is it a guarantee that the journal or the researchers or that the study was conducted with the utmost ethical considerations either. Correct. So I think also, to go back to your question a few minutes ago, is being a part of functional medicine and naturopathic medicine has inherently trained us to be a little bit more critical, right? Because you have to be prepared for these conversations where you're using less evidence-based therapies, but still having a deep understanding, competence, and confidence in what you're doing that is safe and appropriate and therapeutic. And so part of that is you're reading the papers, you're critically evaluating the papers, you're forming your own opinion for how you might approach this for patients in a safe way. And I think that is a slight difference with conventional medicine providers because we are more comfortable working beyond or alongside the standard of care in a way that's still evidence-based, and also having our own guardrails for what we consider evidence-based, knowing what we know about how research is conducted and how slow it is to catch up with what we're seeing clinically. And actually, I literally remember several years ago of you talking to me about GLP-1s years ago when I was first in residency, talking about GLP-1s because you had read the papers about how it decreased cardiovascular disease risk. And now fast forward to now, we see that drug getting approved and rebranded for these new indications, primarily because clinicians did the due diligence like you have to use it clinically. And then they saw enough outcomes research to then say, yeah, we can actually approve it for an additional health outcome. So I think it's really clinicians like you that have been brave enough to actually look critically at what the evidence truly says and be able to confidently voice those clinical pearls and train providers like me and the residents that have come through Vida to not just take the standard of care as is, but really question why that is the standard of care. And when that standard of care isn't applicable for our patients, then what do we do? Which I feel like is another thing that we face as functional medicine practitioners too, is what do you do when you've reached the end of the rope and you've tried all of your options? Yeah.
And functional medicine testing has a little bit of, again, this reputation for being very heavy on the testing. I'm wondering how you use testing. How do you decide to ask the patient to spend that money?
I feel really grateful that with our training that our toolbox of lab testing and monitoring and evaluating through labs is expansive. There's very few of these specialty tests that we haven't heard of or tried or at least been exposed to. And so my approach is, I think of myself as not only a health manager, but really like a wealth manager. Like I'm really helping you to delegate how you're spending your time, energy, money, and all resources in your life, essentially.
I like that. I'm not only a health manager, but also a wealth manager. I like that.
That's true, right? You're asking them to invest in sometimes supplement stacks that are several $100s per month, the concierge membership, the labs, which can be $500 to $2,000, depending on insurance coverage every few months. So these are all very significant financial investments. And so that's part of the conversation is we can invest in labs to have a more targeted and intentional care plan. If you don't do the labs, we might spend more money and time trying to figure out what supplements and diets will work. So it's going to be an investment either way is usually how I frame it to patients.
One of the pieces I've written about is how strongly I feel about not making money on lab testing.
Yes.
Because when you make money on lab testing as a clinic or as an individual provider, certainly, and I know, again, this is part of the business model and it's nothing against providers who do this, but I feel like it's very hard not to be motivated by that.
Totally.
And so when you do lab testing strictly because you want the data, there's a lot more value and trust that I think the patient gets from that interaction. Same thing with supplements. It's very tricky, and we've made this decision that providers do not make money individually. The clinic does, full disclosure for those who are listening, but individual providers do not make money on supplement recommendations. That was intentional. So I think that there's importance to understanding the motivations because it is a entrepreneurial division of medicine. And it is important to know where someone's individually motivated from. And when they see a provider like yourself who makes the decision not to make money in your private practice as well, not to make money on lab testing,
I feel like that was one of the very early on ethical lessons that we learned in school was patients are investing usually cash pay for a lot of these visits. And so a lot of it is out of pocket anyways. And so just keeping that in mind and really approaching it, and again, from this very human point of view of I'm investing this X amount of dollars to just see you. It's an hour to sit with you, which I'm spending outside of work, which I'm also potentially losing money. Also have to sometimes pay for childcare. Sometimes your partner has to miss work. So I think having those types of contextual factors that you get just from talking with patients is really important. And same thing in my private practice, gave the full discount to patients, never made money off of labs because I'm 100% on board that. To me, that is the most ethical way and really the standard for how I think you should really be ordering labs and supplements.
Yeah, I obviously agree with that. So it's not everybody's opinion,
right,
nor is it everyone's business model, but I think it is important to point out that's something to ask potentially somebody who's looking for a functional medicine provider is, hey, do you make money on supplements or labs? And making sure that there is full transparency.
Right. And I think, too, what's great, too, is we have so many providers here, too. There's also multiple options for several labs or supplements, which I think is such the beauty of being a part of this care team is that you're never just recommending one thing because that rarely ever fits for all of the patients on your panel. So having multiple options for whatever recommendations you're making is really important.
I would say you're a master at that, of giving lots and lots of different options. Let's kind of transition to hormones a little bit here. Yes. So I'd love to hear your approach to testing hormones. It's debatable. You can share it. Tell us about the different ways we can test hormones.
Yeah, so we'll start from top to bottom. Saliva, I really only use for cortisol. I rarely ever use it for reproductive hormones, primarily because of just the timing and the fluctuations in the levels. So it's not a very stable marker to really assess for hormones outside of cortisol. We like it for cortisol because it's easy to test for multiple points throughout the day. My primary mode of testing is really in the serum. So that is how I test testosterone, estradiol, progesterone, DHEA, thyroid, insulin as well. And then I will utilize urine testing primarily for metabolites and use it a lot in regards to Mira and fertility testing as well. So if you want to know how the hormones that are getting released from your ovaries and your reproductive organs and your adrenal glands are actually getting metabolized, then you would look at what's happening in the urine. So from top to bottom, I would say that would be my overall approach to hormone testing.
I'd love for us to go into the endometriosis sphere that I know you're very passionate about. Again, What is it? How does it happen? A little bit of the pathophysiology, if you don't mind. Then if you could talk about the relationship between fertility and the gut. I know that's a big ask to include all of that, but if you could try to just tie those things together, that would be great.
Yeah. So endometriosis is a chronic systemic inflammatory condition where tissue that's very similar that's lining the endometrium or the uterus grows outside. And so by having this tissue outside of the uterus, it's this tissue that's sensitive to these hormonal changes similar to how your endometrial lining is. So it grows and develops blood vessels and produces its own estrogen and has its own inflammatory markers and immune system. And I'm pointing at this hypothetical lesion, but there's all these lesions that can grow, particularly in the abdomen, pelvic area. But research shows that it can really grow anywhere that the blood travels to in the body. So we see lesions on the belly button, on the skin, and the diaphragm.
The lungs.
The lungs, exactly. And even on nasal tissue too, with chronic nosebleeds that correlate with menstrual cycles. And so with this like growing and bleeding cycle that these lesions are undergoing, you essentially create these satellite areas in your body that are contributing to inflammation, immune dysfunction, estrogen dominance. Eventually, the lesions die out and lose blood vasculature and circulation, and then they turn into adhesions and fibrosis. This is where we start to get more of the anatomical shifts.
So fibrosis meaning scar tissue.
Correct. Mm-hmm. That can cause these like tightening and pulling of your pelvic organs and tissues that can contribute to pain and really dysfunction if things are getting pulled where they're not supposed to. And so pathophysiology is not TBD, to be determined. No one really knows exactly how it starts. The most common mechanism that we think about is retrograde menstruation. So when you think about the uterus and the fallopian tubes gently sitting on top of the ovaries, that is not a sealed system. And so as you're starting to shed menstrual blood, some of it actually travels up through the fallopian tubes and escapes through the fimbriae into the pelvic cavity.
So let's just pause for a second because I don't think a lot of people know the anatomy nearly as well as you do. So let's just paint a picture for some simplistic sake. Yes. I think of it as a very simplistic, this is how I draw for my patients. There's a triangle.
Yep.
The bottom of the triangle is the cervix, and then there's the vaginal canal. Kind of top, it's upside down triangle, I should say. So we have the kind of flat top, and then we have the corners of the triangle. And that's where those fallopian tubes are coming out, which then are not attached, but close to the ovary.
Yep.
Correct?
I think about them like gentle hand holding.
They're gentle hand holding in the ovary.
Not like an interclasp hand, but more just that.
So a lot of people don't realize this. Yeah. Even medical students sometimes don't realize this, is that the ovaries, it's not like this closed loop system. So when you talk about retrograde menstruation, just define that a little bit, given our very kind of imaginary picture here.
If the fallopian tube is sitting on top of the ovary, and let's imagine the uterus here, normally you're shedding out menstrual blood through the vaginal canal that's how you're expelling menstrual blood. Some of it actually travels up the fallopian tube and escapes out through here. So you can either get endometrial lesions like actually in the ovary, which is an endometrium or a chocolate cyst, or you can get lesions outside of the pelvic cavity. And if we think about expanding our anatomical lens to organs that are sitting right up against your pelvic organs, we have your bladder, we have your GI system, your small and large intestine, and we have your appendix as well. So all of those organs are subject to fibrosis, adhesions, inflammation, immune dysfunction, anatomical distortion. And so that's why it's hard to diagnose endometriosis, because there's a spectrum of symptoms. You can either be asymptomatic and you don't even discover that you have it until you have difficulties getting pregnant, or you could be so in pain that you're losing your job, you're unable to engage in social engagements, you're not enjoying sex because it's super painful, you can't eat anything, you're essentially disabled because it's so physically taxing on your body. And part of the treatment is putting you on birth control to try to control some of the hormonal fluctuations that's causing the development and growth of those lesions. Another modality is actually using NSAIDs and pain medication shouldn't even say pain medication, anti-inflammatories, to actually reduce some of the symptomatic pieces that are associated with endometriosis. And then if you fail both of those, essentially your option is to get surgery, which is both diagnostic and therapeutic. And this is typically a laparoscopic exploratory surgery, because typically endometriosis does not show up on imaging, and that's ultrasound, that's also MRIs. And really the most painful forms of endometriosis, which is the superficial kind, meaning it's on the very outer parts of your pelvic area, tend to be the most painful. Those rarely show up on imaging. So what we have is this situation where endometriosis affects 10% of women worldwide. And we have this very vague bucket of symptoms of chronic pain, heavy menstrual cycles, and difficulty getting pregnant. And if we run through our DDX for everything that encompasses, that's a lot of diagnoses to work through. And we also have a very limited toolbox for which we can use to actually address endometriosis. We have birth control, pain medication, conventionally, pain medications, birth control, and surgery. And then for all of the fertility drugs that we typically use. And so when I was diagnosed with endometriosis, and I was blessed enough to have you as my primary care provider, we tried progesterone, we tried different forms of birth control, we tried naproxen and some anti-inflammatories. And I was one of those people that didn't respond well to progesterone. It made me feel really brain foggy and a little bit depressed. I didn't want to be on birth control, and I definitely didn't want to be on pain medications long term. So literally all that was left was functional medicine, was to change my diet, address my lifestyle, take supplements long term, really be mindful of what's painful and what's bothersome and how much I'm willing to tolerate, and exploring pelvic floor physical therapy and acupuncture and all of these other modalities. And it was shocking to see how much of a need there was for this type of medicine, because there's so many women that just have the only options of surgery, birth control, and NSAIDs.
Or don't get diagnosed.
Or don't get diagnosed.
I think the last statistic I heard is 7 years to diagnosis, something like
7
that.
7 to 12.
7 to 12 from the onset of symptoms. So let's just paint a picture of kind of the typical endometriosis patient.
Yep.
So this is usually somebody who may be late adolescence, early 20s, have very painful menses, And most physicians, functional, naturopathic, conventional or not, will, unless they're a specialist, will typically say, oh, this is just dysmenorrhea, which is defined as just painful menses. That is not the same thing as an endometriosis diagnosis. Dysmenorrhea can be caused by all sorts of things. Now, there can be anti-inflammatories, as you mentioned, in the naturopathic sphere. We can do things like cramp bark or antispasmodics, right, to help relax the uterine muscle tissue. Things like that, if they're not responsive, magnesium, that we have to think outside the box. We have to think outside the box. Oftentimes, a transvaginal ultrasound is ordered. And if you don't have an endometrioma, which often does show up on imaging, endometrioma you just mentioned is a chocolate cyst, then we have to really think about, are we missing something here that really would only be diagnosed with laparoscopic surgery, right? And I think from your perspective and mine, if we're waiting to refer to those endometriosis specialist surgeons and we're waiting for years, these women are suffering.
Oh my gosh. And if you think about, you have a menstrual cycle typically every month. If you're slightly estrogen dominant, you might have more cycles and heavier, longer cycles per month. So that's a significant portion of your life that you're spending suffering, which is heartbreaking to know that's going on for decades long. And then when you think about what we know are the long-term implications of having immune dysfunction, estrogen dominance, and chronic inflammation, it's really so, like, the first step is to get the diagnosis, potentially get surgery and manage symptoms. But what I always really set the expectations are is it's an incurable disease, because we don't really know how it starts. So we try to just create the best environment to ensure that it doesn't happen again. Because the other tricky thing with endometriosis is there's a pretty strong chance of recurrence. So 1 year after surgery, there's about a 20% chance of recurrence. Once you get to 5 years, that actually bumps up to about 50%. And so it's not uncommon for patients with endometriosis to not only have one surgery if they're lucky to get diagnosed, but to actually have multiple surgeries. And so when you think about an exploratory surgery too, where you're moving organs around, you may be cauterizing or excising tissue, we know that type of abdominal surgery or pelvic or laparoscopic surgery can have some long-term implications too for just anatomical alignment in that area as well.
What is one misconception about women's health and fertility that you wish more patients and providers understood?
That is a tough question. I would say that my initial reaction is just that the same plan will work for you throughout your entire life. So if there's one thing that I've learned about women's health, which is part of the reason why I enjoy it is a cycle. When we have several cycles that we go through of different time periods throughout our life. So it's our menstrual cycle, it's our cycle throughout our reproductive years into perimenopause, which is very different than when you get into menopause, which is very different than when you get into postmenopause. And so going back to the beginning part of our conversation, this is truly why I think primary care is so important, is because you're able to follow the patient through those types of transitions and easily adjust and add just a dynamic nature to their care plans that I think is very different, or a misconception to a typical approach to women's health, where you prescribe them something and then you ask them to come back when it stops working. But we know that there's so many things in life that can affect a woman's menstrual cycle that it does require more frequent follow-up and touch points and more constant communication with your patient. So I would say that would be the biggest misconception, is just the importance of primary care, continuous care plans, and dynamic care.
Yeah, I wish that everybody had access to someone who could do functional medicine and primary care. It's just not very common.
Yeah.
And so that, I think, is a unique offering, at least in the greater Seattle area, that we've been able to support. I also wonder if you could comment on the importance of an anti-inflammatory diet and how some of those foundational lifestyle pieces we talked about earlier, some of the fancier testing, and of course the value of certain high quality supplements, but perhaps you could just, our roots are really grounded in the bottom of the functional medicine matrix, and you could just maybe define that.
Yeah, so it's the modifiable lifestyle factors. So parts of your life that you can shift in order to get you closer to your health goals. And what I typically ask patients is, and this is something that I've learned from Dr. Brad Lichtenstein, is the decision you're making in life right now in alignment with your health goals or not? Because if that is a very simple question. And so when you start to piece apart those five modifiable lifestyle factors, which are nutrition, sleep, stress, relationships, and meaningful relationships, that question applies to all parts of those lifestyle factors. So when we think about diet in particular, there's not one type of diet that is the most effective for endometriosis. So essentially, if you are feeling like you're not digesting, the foods that you're currently eating really well, the question is, are the nutrition choices that I'm making in alignment with my health goals? If they're not, then we find what that path looks like, which is typically a whole foods, plant-focused diet that is diverse in several macronutrients. So I would say that is the ultimate goal, is to be able to eat as diversely and as comfortably as possible without any symptoms. Sleep, super critical, which I am not a great patient when it comes to sleeping well. I'm using electronics before bed, and I use electronics when I first wake up. And I think part of my approach to medicine is finding realistic lifestyle shifts, because there's also an element of joy that you just always have to keep in your life for things that just purely bring you joy, and not putting so much stress to live this perfect functional medicine lifestyle. Yeah. But all that being said, sleep is critical. You use it to detox your brain, your entire body. It's your body's way of really, what I think about is closing out the day and opening yourself up to opportunities for the next day, both physiologically and energetically. Stress. It's hard to quantify how impactful stress is, because we are so good at normalizing it. We're also really good at not recognizing how it manifests in our body, which I hear you ask this to your patients all the time. You're not stressed, but how do you think stress manifests in your body? And sure enough, they're noticing that their sleep's impaired, they're not eating as much, they are spending a lot more time watching TV versus moving their body. So those types of questions, and again, the decision on if it's in alignment with your health goals or not, is really important. Relationships. So when we think about sexual health and fertility and women's health, your relationships with your community are really important, because being able to talk about what you're going through feels very taboo when you're talking about menstrual cycles and fertility and sex with your partner. And so to have that type of community and relationships, both with your partner and whatever your social circle is, critical to you doing some emotional processing outside of the visit. And then Movement. Thank you. Movement exercise. So movement exercise, my approach to movement and exercise is really, again, focusing on what your health goals are. As we have several patients that are bodybuilders or physique competitors, or they want to just maintain their current body mass, or they want to lose a significant amount of weight. So those types of goals have very different exercise approaches. My very baseline is doing any type of movement stacks. So keeping exercise equipment all over your house and squeezing any type of movement in wherever you can, whenever you can. I would rather you do that than stress out about doing a 30-minute workout and then not doing it. And then I'm a huge fan of putting on muscle. So I think that is a huge misconception also with women's health, is that we shouldn't be lifting heavy and that we shouldn't be putting on muscle. But you've been preaching this from the very beginning about how important that is because of what you know about insulin and what you've taught me about insulin, and how muscle is really this insulin sensitizing organ, which is how we protect ourselves from those metabolic shifts that we were talking about through perimenopause, menopause, and beyond.
It's one of them, by far, one of the most important things that if women can make a shift is looking at, from a DEXA scan, what is your lean body mass compared to fat mass, and working on increasing that lean body mass, or if you have a lot of weight to lose, potentially maintaining your lean mass as you lose fat mass. And that requires this combination approach, which is a whole nother conversation, right? But I could go down that road. But oh gosh, we didn't even get to half of what I wanted to talk about, but that's okay. We'll have to have you come back.
Okay, I'll come back.
Yes, it was so fun to have you. Maybe you could just share a little bit about your next steps and your journey, and just how, gosh, just we're so proud of you in how you have flown and spread your wings and then flown. I guess you have to open the wings first.
Yeah. I will be transitioning to more of an executive level position through my other job outside of Vida, which is at Ovation Lab, which is really as a clinical implementation and AI specialist. The primary goal of my position there is really to translate any new innovative technology, research, brand that would like to speak to doctors and help them basically communicate their findings in a way that doctors can easily apply their technologies in a way that doesn't clog up their workflows. Because as with functional medicine, we get thrown a bunch of new labs, supplements, technologies that we want to try that are new and great for our patients. The goal for my position is really to disseminate that information where you're getting the highest quality information, highest quality products and brands, and having a framework to immediately put that into your practice. And this is coming at the culmination of just all of the mentorship and training that you've given me literally from day one, just in regards to the high level of expectations that you place on myself as your first resident, but really for everyone in the program. It breeds this level of just performance that I wouldn't have been able to be in this position without you pushing me in that way.
I'll give you the $100, I promise you, later.
I will just take that to go get dinner later.
Yeah, exactly. But I also want to remind you that you did tell your entire residency cohort in your first year that I was taking you to the point of drowning. And so I just want to mention that just for anyone who's listening, that at one point you did say that you were taking on water. Yeah. But I do appreciate that you now look back and are grateful for it.
It was like Navy SEAL training, but for residency.
That's how it should be. Yeah. That's how it should be.
And I'm fine now, so it all worked out okay.
And you're teaching, right? You're teaching. And so just for those who are worried about who's going to carry the torch, right? Now that you are transitioning, I think it's important to note that you have also been working with our existing team at Vida Integrated Health, specifically on approaches around women's health. And I think that you'll continue to be involved in one way or another. And certainly your expertise in endometriosis is only a call away. So I just want to thank you for your work and your continued work. And it's been so fun to chat with you.
Oh, thank you for having me.
Yes, absolutely. So we just spoke to Dr. Alexis Gonzalez. I hope you enjoyed this episode. It's been so fun to sit here and chat with you. Please stay tuned for future episodes of Vitality and enjoy your day. Thank you, everybody.